Megan from Aspire Health and Rehabilitation. I'm going to be showing you a taping technique for the knee using Rocktape or K-tape. Now with this particular taping technique, it is quite helpful for those that suffer knee pain or patellofemoral pain. And you can either use the 5cm K-tape or the Rocktape or the big 10cm one, depends on what's available. Usually the smaller one's available. You will be needed to be sitting in a sitting position to start, and you will need to start up at least 10 centimeters from the knee. Okay, you will be needing 2 long strips, both originating from the one area on the inside of the thigh. The reason being, with knee pain, with any sort of pain, muscle tends to become inhibited and not work efficiently. So what can happen, having the tape starting on the one anchorage point and then stretching the tape, this stretching kind of sensation, especially when you are moving through range, it can provide a little bit of a stimulation to the area, which may help get the muscle activated a little bit. That's what some suggest. But it is quite helpful to start from the one area, and then you're going to be doing some taping, long taping strips. Make sure your area is dry. It won't stick well if you're taping on an area that's wet or sweaty. In saying that, I do suggest taping something like this maybe half an hour before an event, like running or some sort of sport, because it needs some time for the adhesive to stick quite well. From the tape, like I said, you're going to be starting from one anchorage point, and you will be putting it on roughly about 70% stretch. The tape itself can actually stretch up to 180%. You don't want that much. Essentially from here, and you're just going to be taping one strip around here, starting from the same anchorage point up and around the other side, avoiding the kneecap, and you're going to be providing like a decompression strip, which I'll show you what that looks like. So I'm just going to go ahead and cut my tape. Now, I always take the edges off my tape just so it doesn't get caught on clothing. Okay, so the first ends or last 2-3 centimeters of the tape you don't want on stretch. You need an anchorage point, and if you apply all the tape on stretch, it can increase the risk of like skin irritations. Okay, so I always take 2-3 centimeters of the top, lay it down flat. From here, you're going to be, like I said, keeping the knee bent, holding onto the tape, okay, coming up, down and around the kneecap, and like I said, just laying off that last 2-3 centimeters without stretch. Getting the other tape again, 2-3 centimeters, just applying it next to the tape, again ranging from the inside of the thigh. Holding the tape, coming down and around the other side, letting the last go a little bit, just not on stretch. Okay, you can rub it down a little bit to try and activate some of the adhesive. Okay, the next part now is to try and offload the tendon that runs from up here and down, right underneath the kneecap. It's called the patellar tendon. A lot of the quad muscles, or nearly all the quad muscles, come around and attach through here, and it attaches on through to the shin. Okay, so all you need is a little bit of a strip. Again, I just round off the edges. This tape here, you can provide a little bit more on stretch. Like this one, maybe 50 to 70% stretch, for example. This one's more like 80 to 90% stretch. And just holding it like a band-aid again, last 2-3 centimeters without stretch, and essentially applying it directly across underneath the kneecap, just like so. Again, last 2-3 centimeters not on stretch. Okay, so essentially this is the taping technique. When you stand up, you will have like a crinkly old knee. That's what you want. You want the skin to be lifted a little bit. And that's essentially what you're going to be doing. Like I said, half an hour to an hour before an event, you can tape your leg and then give it a bit of a rub to try and activate some of the adhesive, and then you'll be on your way to doing some sporting activities. This type of tape, it doesn't restrict movement. The K-tape, it does provide some support, but it actually allows you to move through range compared to the rigid tape. So something like this, you'll be able to not be restricted in range, but we'll still provide a little bit of support. Thanks for watching. If you want any more access to other videos and articles, check out our Aspire Health and Rehabilitation YouTube page. We also have a website, www.aspirehealthrehab.com.au, and you can also give us a like on Facebook and Instagram.